Hi, I'm Dr. Pfeifer, an aesthetic plastic surgeon in New York City. Welcome to my channel. Today we're going to talk about how to prevent capsular contracture. I talked in an earlier video, which will be linked below, about what capsular contracture is. And basically, it's a veil of tissue that your body makes around the implant. It acts like a second shell, and under normal circumstances, it's very thin and supple. If a person has capsular contracture, that capsule has gotten thick and somewhat stiff, and it can actually start to compress the implant, distorting its shape and making the breast feel firm. So how do we prevent this? We know what happens in about 2 to 7% of patients, and we want to get that percentage as low as possible. There are several things that the surgeon can do in the operating room. We follow all of these procedures for each and every one of our patients every day. Capsular contracture is thought to be due to the presence of some bacteria that become associated with the implant at the time of surgery. So the idea is to minimize any contact of the implant with the air or any surfaces, because even though the environment is sterile, there could still be a few bacteria around that could then become attached to the surface of the implant. So starting from the beginning of the surgery, the patient's skin is sterilized with a prep. And then after the skin is sterilized and I'm scrubbed in, I'm obviously sterile also, I put a Tegaderm, which is a clear sterile Band-Aid, over the nipple areola complex. This is very important because there are bacteria in the ducts of the nipple. So if you do not cover the nipple, then bacteria could come up to the surface and get on the skin and get onto the surface of the implant during the surgery. And there was a great study where they actually looked at this. They put the sterile Band-Aid on the nipple, they did the surgery through an incision in the crease. At the end of the surgery, after the incision was closed, they peeled off the little Band-Aid and cultured the undersurface of it. And in 30% of the cases, there was bacteria there. So that tells you that you really have to avoid the nipple during surgery if you want to protect it from bacteria. So that means that all of the surgery in my practice is done through the crease, because that allows me to isolate the nipple and do the surgery through the crease so that there's no bacterial contamination from the nipple. Now, after the implant pocket is made, I'm going to irrigate the pocket multiple times with an antibiotic solution. There are bacteria that live in the breast tissue, and when you're making the pocket, even though it's behind the breast tissue, it's possible that some bacteria are exposed in the breast tissue, so you want to sterilize the pocket that the implant's going to go into. Now, a very interesting thing, which I'm going to show you on another video, is that when we open the implant comes in 2 containers. So it has an outer container, and then we lift the sterile container out. If I just peeled open the sterile container that contains the implant, there's an electromagnetic charge on the surface of the implant, and anything that's in the air will be drawn to and stick to the surface of the implant. We're going to do a separate video showing you this with pink glitter. So it's very important for the surgeon to keep the container closed, inject some antibiotic or sterile solution into the container and swish it around. That discharges the electromagnetic charge so that when you do open the implant, you're not going to have things from the air becoming attached to the surface of the implant. After the charge is discharged from the surface of the implant by coating it with the liquid, the implant is poured into a Capsular funnel, which is a sterile sleeve that, as a surgeon, I put the tip of it into the incision, into the skin incision, and then you squeeze it and it presses the implant into the pocket. So the surgeon doesn't have to touch the implant, and the implant doesn't touch the skin of the upper abdomen when it's being inserted. So the Capsular funnel is a very good device that we use to protect the implant from any bacterial contamination, and it also helps the surgeon use a shorter incision to place the implant in the pocket. Once the implant is in place, the surgeon will close the incision and the patient will recover, obviously, and go home. Now, long term, we do see some patients that develop capsular contracture maybe 5 or 7 years after surgery. And it's thought that those patients are not developing capsular contracture from bacteria that's associated with the implant at the time of surgery, but perhaps there's some bacteria that becomes attached to the implant somehow later. How could that happen? Perhaps something as simple as a dental cleaning. So when you go to the dentist, you might have a little blood in your mouth. Anytime you have a little blood, that means there's a little vessel that's open and there's tons of bacteria in the mouth. So if you have a little blood vessel that's open, maybe a few bacteria got in there, got into your bloodstream, circulated around, became attached to the surface of the implant. So to protect against that, we advise all of our patients to take an antibiotic pill 1 hour prior to any dental procedures, even something simple like a dental cleaning. This would also apply to anything where you're going to have the skin broken and there's a little bit of blood exposure, maybe a tattoo or a piercing, anything like that. Take one antibiotic an hour before. The antibiotic is in your bloodstream, and if a bacteria gets into your bloodstream, it will be immediately neutralized and killed by the antibiotic. So I hope this explains a little bit about what we do to prevent capsular contracture so you can have a soft, natural looking breast after breast augmentation. See you soon.